Dumelang Mzansi, Sanbonani, welcome to the Health Club. I'm Clement Manyatela, your host. Today's show is for anyone who's ever thought it won't happen to me, because the truth is, cancer doesn't always come with a warning. And some cancers, the ones we hardly ever speak about, can go undetected until it's too late. From testicular cancer to melanoma, we're shedding light on the cancers we don't talk about. This one's for the survivors, the fighters, and those who didn't get a chance to know sooner. Grab a seat for the conversation, because what you don't know could save a life. Take a look at this.
I think women are so in touch with examining their breasts and going for their pap smear. I always tell my male patients, have the balls to talk about your balls.
You should be able to see the symptoms, and you should know that, okay, now I might have cancer, I should check it out before it's too late.
I don't feel there's enough information on cancer for the everyday person.
Going through cancer, there's a moment that I had in my life where I went, maybe this was the universe's way to say, okay, you're done. You know, you've had your time, this is your ticket out.
And that's why we're having this conversation, to bring visibility to the things we often leave unsaid. Testicular cancer is one of those things. It's not just rare, it's rarely spoken about, especially among young men and in the LGBTQI+ communities. We spoke to someone who knows this journey firsthand. Charles Jekuado van Helstingen is a testicular cancer survivor and former Mr. Gay South Africa. He opens up about his diagnosis, his fears, and what it taught him about listening to his body. Let's hear his story.
My name is Charles Jekuado van Helstingen. I'm 34 years old. I'm a personal trainer and currently studying my diploma in sports psychology, and I'm a testicular cancer survivor. Testicular cancer is not a very much spoken about cancer, and when I was diagnosed with testicular cancer, my knowledge was very minimal, and it made me realize that we don't have a platform for men to get the knowledge or have a community that they can reach out to speak about such an uncomfortable subject. So I first discovered that I had testicular cancer in March 2018. Like a lot of us young men like to do, I was just sitting on the couch watching TV, had my hand down my pants, and I had discovered a lump that hadn't been there before. Working my way back to becoming a healthy person was really scary, because we do take it for granted, daily things, and it's something I will never ever forget. And today I strive to live my life in a healthy, balanced way. So going through cancer, there's a moment that I had in my life where I went, maybe this was the universe's way to say, okay, you're done. You know, you've had your time, this is your ticket out. And for a moment I believed that. And by having this correct support system and people that love you to remind you of your value, your worth, your place on this earth, is everything a person really needs to push through chemo, to push through treatment, to get to the other side. Because when you know that you're loved and you're once around and you make a difference, you want to fight. At first was very difficult for me to engage sexually or feel confident as a man having lost a testicle. It's a journey you walk through as a man, to realize that one testicle isn't what makes you a man. And again, that just led me to going, how do we include everyone in a community to come together to have one channel of support? So big plans in motion at the moment to widen my reach of educating young men around the world. I will have an international platform directly aimed at men, because we represent men of essence, and we're basically there to help uplift younger generations, educate them, and drive bigger change. So that's the next step I'm taking now, to just create a bigger reach in the universe.
Welcome back to the Health Club. That was such a moving story from Charles, and a reminder that our bodies speak to us. We just need to listen. Now, when it comes to cancer, especially testicular cancer, awareness is just the first step. Early detection and prevention can truly save lives. Joining us in studio are two guests. We first have Dr. Doni Fick, who's a general practitioner and a cancer associate, and Naniki Siboni, who's a skin cancer survivor. Naniki and Dr. Fick, thank you so much for joining us.
Thank you for having us.
Dr. Fick, let's start with just testicular cancer and why early detection is so critical, especially to young men.
I think when it comes to cancer in general, early detection is so important. Testicular cancer is usually found in younger age groups, and those are usually the age groups where we think we're too young to have cancer. We still, it's an older person's disease. Unfortunately, testicular cancer is more a young man's disease, so that's why we want to advocate early detection, screening in the entire population group.
Yeah. Naniki, when did you realize that something is wrong? What were the signs for you?
There were too many signs. We just didn't know that these were the signs. When I was 5, 6 years old, I started having issues, burning in the sun, multiple sunburns. And you think about that at 5, 6, it wasn't on me to be aware that something's wrong with my skin, right? So my parents didn't know what they were dealing with. So when it's continued to progress, I'm a teenager, I'm still having issues with my skin, and then in my 20s, now this is a really long journey. In my 20s now, I have developed this very serious and very painful mole. And at that time, I'm 24, and I have a stage 3 skin cancer diagnosis.
My goodness. So that then speaks to the issue of just knowledge as well, Dr. Fick. How important is that? Because sometimes, as Naniki says, there are signs that are there, but we just don't know that these are signs of something problematic.
There's two phrases that come to my head. I feel like there's so much information, but not enough knowledge. And I think this is why we're here today, right? We're embarking on this journey to educate. We've got so many platforms available to us in 2025, which you most probably didn't have when you were younger.
100%.
All these social media platforms. If we can just encourage people to take their health seriously, look at things like moles, your testes, your breasts, all of those things, go for checkups, but be aware of these things because we can't live in denial. We need to know what we're dealing with because, as you said, early detection and prevention leads to life-saving interventions. That's why, dare I even say, you're still here with us today because of that early detection, and it's so important.
And we'll talk about the journey and how we managed to get here, Naniki. But as soon as you realized that this is the diagnosis, did you even know what that kind of cancer is? And what was the emotion for you? Just help us understand that personal experience from then on.
I definitely didn't know, nor did I understand what that diagnosis meant, never mind the staging, but it's a malignant melanoma. So that in itself is something that needs to be unpacked because we look at skin cancer in different ways. There's basal cell carcinoma, squamous cell carcinoma, there's your melanomas. So I'm sitting at the end of this skin cancer scale, and then there's also a malignancy to it. So it's like, how does one really have the opportunity in the middle of the diagnosis to say, let me take a step back and really unpack what does skin cancer mean, what does a melanoma mean, what does a stage 3 diagnosis mean. So a lot happened in that moment. I was dumbfounded, and I've been famously quoted by saying, but I thought, but I'm black.
Isn't that the misconception we have?
100%, because we always think that our melanin is going to protect us.
And even though people with darker skin tones are less likely to develop skin cancer, it's still a problem, right?
It's still a
we
problem.
Can't have that notion of we have darker skin. We're not going to get cancer. Unfortunately, you are a living testament to that. That is indeed the case.
Dr. Fick, let's also talk about just the shame that comes with discussing anything to do with testicles. I mean, how do we move past that? Because part of the reason why people are not going for early detection, or even when they go, they don't want to talk to anybody about it because you're seen like, oh, there's something wrong with your manhood. How problematic is that in not helping us in the fight against this kind of
Very
cancer?
problematic. I think women are so in touch with examining their breasts and going for their pap smear. I always tell my male patients, have the balls to talk about your balls. I think it's important, right? And because testicular cancer is such a young man's disease, if you encourage your sons to go and do self-examination, talk them through that, it's so important. But we really need to debunk this whole men's health epidemic, dare I say. We don't talk about our genitals, our sexual performance, our lack of testosterone when we get older, our lack of libido, our sexual misfunction, our mental health. It's all a package thing. I think men just generally need to do better at talking about health.
And how when it comes to self-examination, what's the best way to do it correctly?
So just lying in the bath or even lying on your bed and taking your 2 fingers and just rubbing your testes through there to feel for any lumps or bumps. I always tell people it's almost like feeling a small little, almost like the size of an astro, a small peanut that feels abnormal on your testes.
So as soon as you feel something abnormal,
please go and see a healthcare professional.
Professional.
Don't hide, because don't feel ashamed because it's in your genital area that you're too ashamed to talk to an adult, a caregiver, or a healthcare professional. We have to break down that stigma if we're going to win.
So we are happy that you are here after everything that you have gone through. Tell us about your treatment. How did that entail? How did you make it here?
My goodness. So one thing that we get to understand about cancer is that there's different types of treatment, right? We know the main ones. It's your chemotherapy, it's your radiation, it's your surgery. And then now we have new things like immunotherapy for, you know, us skin cancer girlies. But for me, and this is where I felt like, did we do everything we could do? Because I had no chemo, I had no radiation.
No radiation?
All I had was a surgical intervention. And because, again, I didn't understand what this melanoma was or, you know, the extent of it, I felt like maybe I got off scot-free.
So the one thing, sorry if I can butt in here for a second, like when you think skin cancers and you hear malignant melanoma, you think death sentence immediately. It's such an aggressive cancer if not caught early. And I think you're in such a lucky position or fortunate or blessed position that it was caught early, because if caught early, it's actually got a very high survival rate. You cut out the lesion, you get big margins, you go for regular checkups, and you don't even need the chemo and the radiation if cut out with clear margins. However, if you leave it too late and it's now starting to spread into the lymph nodes and other organs, then you're in trouble. And then this monster of a cancer gets much more aggressive. So back to our point, prevention, yes. Early detection when it comes to melanoma is so vital. You are living proof as to why it is so vital.
Key.
Yeah. What's the one thing you wish people knew about this kind of cancer?
Look, people always think that skin cancer is a white people disease. It's not a white people disease, it's a people disease.
Yes.
Right? Because when, again, going back to the whole melanin thing, is that people with darker skin, I mean, your natural melanin, that natural SPF that we have is like a SPF 13, if we're looking at it. So the recommended dosage for our SPF is 30. So already there's a need for us to double up, and we're not doing that. So you're not immune because you have darker skin. You're not immune because you don't want to talk about it. You know, cancer affects everybody, and as long as if you're human and you've got skin cancer can, you know.
What are some of the misconceptions about, you know, cancers like testicular cancer?
I think the big misconception with testicular cancer is it's an older person's disease. So lots of young people get missed because they think it's only going to be a problem when I'm 40 or 50. Back to what you said, even though we have melanin in our skin and people think that it's not a black person's disease, we have some of the harshest UV rays in South Africa. So not only we're fighting two problems almost, like people are like, we don't have to protect ourselves, yet we have some of the harshest sun rays in this country.
Sure. So how prevention is better than cure, right? Always. Do you think South Africa's healthcare system is doing enough when it comes to early detection and support for people with that kind of cancer, from your experience and your observation?
Enough. So we are trying from the patient perspective, we're trying from an organizational perspective to really get the word out. But I really think that from a department, from a provincial, we need to be doing more. We need to be having this conversation more and not just say, oh, in the hot months only do we have this discussion. We need to be having it year round.
Yeah.
And I think also not just that, like I think cancer, you've mentioned them, they do a lot of screening things at every sort of running event, cycling event, but some of the brands that make sunscreen and photo protection have now jumped on this as well, and they pushing education, they pushing screening. There are a lot of people, public and private sector, have got together with healthcare professionals, people who have survived, to try and spread the message, to try and do as much as we possibly can. So I think hats off to those people, no pun intended, hats should stay on, but not hats off to those people. But I think people are noticing that it's a problem, and we're trying to pull together to make a difference at least.
What's your message to young people watching us now in as far as just safeguarding their health? What do you say to them? Especially in just making sure that you can quickly detect cancer early, and if you do detect it, you do make sure that you see the relevant specialists and medical specialists to attend to it.
My take-home message is like everyone talks about investment and invest in your future. Put this money away, put this away. I think investing in your health as early as possible, as young as possible is so important. And when you think of skin cancer particularly, as you said, protect yourself from an early age. Most of the damage gets done before you're 18 years old. By the time you woke and you like tuned into your health, you're 30. The damage is done. Let the youth not be wasted on the young.
Isn't another issue here, Dr. Fig, that people are scared of the process of also testing? I mean, when you speak to your friends and you're like, okay, you need to check if you have prostate cancer, the first thing they ask is, how are they going to test that?
Are their fingers involved?
Are their fingers involved?
We live in 2025, right? So there are blood tests that are now available called a PSA, prostate-specific antigen. So you don't necessarily always need a finger test. But my professor at university always said, if you don't put your finger in it, you'll later put your foot in it down the road, right? So if we're not doing the testing, you're going to end up with chemotherapy, radiation therapy, big surgeries later on down the line, and that's what we want to try and prevent.
If there's someone watching us now who is going through a difficult journey of trying to survive cancer, it may not be skin cancer, what's your advice?
I think we need to talk. We really need to have these discussions openly, have a safe space for people to just say, look, I'm not okay, my body doesn't feel right, and with you not feeling okay is what are the next steps? Go and speak to your healthcare professionals and have honest conversations. I always say the two people you need to be honest with is your doctor and your hairstylist. You know, anything that happens after that could be quite detrimental. So I really would like to encourage people to have open dialogues with their loved ones, because as you're saying, like, these things we need to educate when people are younger, because that's how you learn to have better habits when you're older.
Yeah,
and I think that comes down to what you said earlier. You asked about cancer treatment, right? And you spoke about surgery, chemotherapy, radiation therapy. And I'm very passionate about this. And I think the big part that we're missing in all of this is psychotherapy. We always it's always a diagnosis. It's always like stage 3, stage 4. Yeah. What about the family members? What about the patient? What about all these people that are affected by a cancer diagnosis? And I think as much as chemotherapy and radiation therapy is important, I think we also need to focus on psychotherapy, counseling these people properly, counseling their families. There's so many people that are affected by one diagnosis. Yeah. And that's where I think we can really do better going forward.
No, that's absolutely true, because I think for me, I always say that my cancer wasn't really the physical, it was more of the mental. I struggled mentally to just cope with my diagnosis. So I definitely concur with that.
Well, Naniki, we're glad that you're here with us.
Thank you.
Right, after what you've gone through. Dr. Fig, thanks to you as well for joining us.
It's my pleasure.
Well, important insights there, right? And a powerful reminder once again that your health is yours to own. But what do South Africans on the ground really know about testicular cancer? So we hit the streets to ask men of all ages if they've ever heard about it and even talked about it or even thought about checking themselves out. Here's what they had to say.
I mean, I've heard stories, then there's some personal stories I know of, because I've got a cousin with testicular cancer, then I've heard stories of breast cancer, and it's just those two I know of, but then I'm sure there's a lot of other types of cancers out there.
I think it's a malignant cell that attacks your other cells in your body. That's as far as I know.
Yeah, I believe that there are people with cancer. For example, I have a case study, and I also believe that they need medical attention as soon as possible.
It should be, because you should be able to see the symptoms and you should know that, okay, now I might have cancer, I should check it out before it's too late.
I don't feel there's enough information on cancer for the everyday person.
Yeah, I think that breast cancers and other cancers has more potency, because it's like a virus. It spreads so fast, and then if you don't have the information on time to know what to do, it can be very fatal. So I feel those kind of cancers have to be quickly addressed and quickly attended to, and people should know what is it all about and what signs you can feel, you see to know this is the cancer of the breast or something else.
So, like I said, I've got a cousin with testicular cancer, and at first it wasn't like very visible, you know, because it's testicular. But once it was, you know, chemotherapy, radiation, having to go through all that struggles, you know, he got weak, he had to lose hair, he couldn't go out in the public, we couldn't have fun with him anymore. It's like losing someone before you actually lose the person.
I think it's because they're more prevalent compared to the other types of cancers. I think even lung cancer to some extent.
Clearly, there's still a long way to go when it comes to conversations around testicular cancer, from awareness to action. But the more we talk about it, the more we break the silence and the stigma. Sometimes it's the quietest health issues that need the loudest voices. Stay with us. After the break, we unpack how medical schemes like GEMS are stepping in to support cancer screenings, early detection, and member wellness. We'll be right back. Welcome back to the Health Club. Today's conversations have underscored a vital truth, and that is early detection is key in the fight against cancer. Medical schemes like GEMS are stepping up to support this by offering comprehensive screening and preventative care benefits to their members. These benefits are available across all options and are payable from the risk benefit, ensuring that eligible members and beneficiaries have access to essential screening. Let's take a look at how GEMS is helping members manage their health with dignity and care.
In this edition of GEMS News, we shed light on cancers that often go unspoken of. Cancers such as prostate, cervical, colorectal, testicular, and skin cancers affect many people, yet awareness and screening for these cancers remain limited in our communities. These conditions are highly treatable when detected early, but lack of awareness can delay diagnosis. GEMS encourages all members to use the preventative screenings and oncology benefits provided. By staying informed and proactive, you are investing in your future health. Your GEMS benefits include cover for preventative screenings and treatments, empowering you to take proactive steps towards your health. Speak to your healthcare provider and learn more about the GEMS Oncology Management Program and how to register should you be diagnosed with cancer. For more information, visit the GEMS website or contact us through our social media channels.
That brings us to the end of another powerful episode of the Health Club. Today, we heard real stories from brave men and women, but especially men who have faced cancer head-on, and the experts working tirelessly to support early detection and better outcomes. Let this be a reminder that talking about men's health isn't a taboo. It's necessary, it's urgent, and it could save a life. To all our viewers, especially the men watching, get checked, ask the questions, and take charge of your health. Your life matters to your family, your community, and to you. Ngiyabonga, Rialebocha. Thank you for watching. From all of us here at the Health Club, take care and see you next week.